everyone. Welcome to Close Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Janice Marie. On each edition of our show, you have the opportunity to meet some of the most innovative business leaders in the country today. You'll find out what their products, services, technologies, and business models can do for you, and what they're doing to change our world and to change the way we do business.
Of all the medical problems one hears about in society these days, which often have wide-ranging ramifications for both family members and co-workers alike, it is the fact that one of the most serious of all is at the same time one of the least treated of all. And I'm talking about sleep disorders. That is, problems that prevent an individual from getting enough sleep at night so that it has an impact on almost everything they do during the day. And the longer it goes on, the worse things get. Unfortunately, on a national basis, there are not really that many experts to consult on this matter. But that is what is being studied right here in this Dallas Sleep Lab. Dallas also happens to be the home of one of the most highly regarded sleep disorder experts in the country. Her name is Dr. Margaret Mike. She is a board-certified neurologist and a specialist in sleep disorders.
It's good when they bring their spouse. If they can't, we have a long questionnaire, 11 pages, that they fill out. And sometimes the patient will fill out their part and then their spouse will go through with a different pen color and put their impressions down, because often the spouse is more aware of how the sleepiness has changed over time. If they're observing pauses in their breathing while they sleep at night, some of those symptoms, we'll look and see what the spouse has noted on there. Or if they come in, certainly their contributions to the history. We go over the history. And many patients, if their symptoms are related to sleep apnea, will explain about sleep apnea. And normally for virtually all patients who come in for evaluation, they're going to get a sleep study in order to find out what's either making them sleepy during the day or what's giving them difficulty falling asleep or remaining asleep at night. And so we'll explain that process, then we'll have them come back for a follow-up, and we'll explain what the results showed and what the next step is based on the results from that night.
Dr. Mike and I have been having a relationship about restless leg syndrome for a long time. I was a disc jockey in Daytona Beach, Florida at the time, and doing a morning show. Try being a morning disc jockey when you can't get any sleep. You try to go to sleep at night, and this sensation where you felt like you had to get up, and there was a big parking lot next to my apartment complex in Daytona. And I used to get up in the middle of the night at 3 o'clock in the morning when I had to get up at 4 anyway to go on the air. I'd run around the parking lot. It was just very frustrating. It was nice to have a neurologist that knew about it, understood. Dr. Mike knew what to prescribe, had information about it, because I had been to a few other ones that didn't, and it was very unsatisfying to go through that.
The fact is, sleep disorders really come down to affecting almost all areas of someone's life.
That's why we use the moon and the sun in our logo, because part of it is the sleep at night as well as the alertness during the day. Some people say, I don't have a sleep disorder, I sleep fine at night. It's during the day when I can't stay awake and I can't function properly. And so it's a quality of life issue. People can't spend time with their family, they can't stay awake just to watch a movie or to read to their children, or at work. Their memory, their concentration isn't as good, particularly midday. Our body has a second natural tendency to be able to sleep, kind of a biologic basis of the siesta. So if we don't get enough sleep or poor quality sleep, it tends to hit in the afternoon. For some people that's after lunch, some people it's late afternoon. And there's an increase in automobile accidents mid-afternoon for that reason. People are more tired, they're just not paying attention as much, and they're more likely to have accidents. Not necessarily falling asleep at the wheel, but perhaps just not paying attention to who's in their blind spot off on the side, or if someone else makes a sudden move to not be able to brake in time, not be able to respond in time.
Came here and went through the sleep lab to find out my depth of sleep, whether I was getting REM sleep or what stage of sleep I was getting. And the first lab just wasn't real good. I think I wasn't able to get the sleep that they were looking for in the study. The second one was a little better. After that, she began to treat me, giving me medication in order to rest at night. Things really began to get better. Took the mask at night that I would not have a problem snoring. I can't tell you that the rejuvenation of having energy again, not being tired, able to sleep, and then wake up refreshed and energized. And the problem was gone.
Dr. Mike, you keep referring to CPAP. What is CPAP? What does that mean?
CPAP stands for continuous positive airway pressure. That's basically the little air compressor that keeps the airway open during the night. A lot of people are more familiar with the term a breathing machine. But some people, when they hear breathing machine, they think a respirator, like something big and bulky in the hospital.
And that's what we have here.
Right, they've gotten a lot smaller over time. They can fit in a briefcase, and it takes regular room air, and it sends it out through a little hose here under pressure, and we determine what pressure is going to be appropriate to keep that airway open and eliminate the snoring. The machine is set, and then the patient uses it whenever they sleep. If they nap, or if they sleep at night, or if they travel, they can take it with them.
And they're connected to a mask. You have a lot of, they look like masks to me. Describe what these are, because each one is slightly different.
Right.
What makes the choice that you pick?
Well, the basic goal is to have a seal around the nose or the mouth, so the air is going to go into the back of the nose and the throat, and it isn't going to leak out into the room, so it can keep the airway inflated. Right. Now, some people have bad allergies, they can't breathe through their nose, they've had fractures of their nose, and they're the larger masks like this. It covers both the nose and the mouth, and that way they can breathe with their mouth open during the night if they need to. But not too many patients actually need that. Usually if their allergies are treated, they're able to breathe just through their nose and use something smaller.
I don't know how many times a minute that I woke up. It was unbelievable, but I wouldn't get any sleep. My regular doctor said I looked awful. I went over here, went through the sleep study. I got a mask, which forces the air in your mouth or up your nose, depending on which kind you get, and immediately helped. I mean, it was just like day and night. I started sleeping at night, getting 6-8 hours of sleep, and it was just a wonderful, wonderful thing. It saved my life, I think.
He's always had sleep disorders, yelling, punching, very restless sleeper, restless leg syndrome, a lot of problems. But all of a sudden this thing just peaked and he was falling asleep, standing up. I would find him standing by the foot of the bed and he would fall asleep standing and fall forward. He would fall out of the bed, he'd apparently sit up and fall asleep and fall out, and there are actually cracks in the walls where he hit the wall falling out of bed. Gave him a hot cup of coffee one day and he fell asleep like that, dropped the cup, spilled it.
These are called pillows, and these have been pretty popular with patients. They're different manufacturers. They just seal at the edge of the nostril, and they come in different sizes, and that way the air isn't going to leak out around the nose. They're not really going into the nose, they're just sealing the nostril. And it's nice because it's open, so people can wear their glasses if they read before bed. If they're claustrophobic, this is much more open for them. So this has been a pretty popular option. This one, a hose comes down, some they come up or to the side. This is another example of pillows, and instead of having the hose come down, it comes up over the head here. Some people like to hook the hose up over their headboard so it's not in the way. With something like this, people may put it under their covers. It's really personal preference. Essentially, all do the same thing, just in a different way.
I would wake up choking on Skittles, Cheetos, raisins, bananas, all kinds of things. I mean, candy was stuck to my back, it was in my hair, it was a trail through the house, and I didn't remember any of this. And my husband would say, "Why are you getting up and eating?" And I'm like, "I don't even know I'm doing it." I saw her in a magazine, a Fort Worth magazine, it said, you know, sleep doctor, but she's in Dallas. I called a sleep study and I said, I want to talk to her. I need to talk to her. I did get to see Dr. Mind finally after, and I guess I saw her first in October, and this started like in November of the year before. And like I said, I'd never done this before. She said in my initial consultation that she suspected that ferritin levels in my brain were low. Sometimes I still experience some getting up, but I'm happy.
Sleep is something that really hasn't been understood. Why do we spend almost a third of our life, or at least a quarter of our life, in that stage, and what's its purpose? Breathing changes, a lot of hormonal rhythms change and everything during sleep that other areas of medicine had yet begun to appreciate how, again, just breathing changes in dream sleep and in non-dream sleep, how that impacts different medical disorders, how it can impact diabetes, high blood pressure with the stress of working hard to breathe if there's untreated sleep apnea.
And there you have it, a look at the latest developments in the subject of sleep disorders, the problems they cause, and the treatments to help bring them under control. I'm Doug Llewellyn reporting from Dallas.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.